You may now begin your presentation.
India, the land of infinity, with 1.3 billion people that speak over 1,600 languages and belong to 2,000 ethnic groups. India is the epitome of diversity.
The Indian story is not limited to the multitude of its cultures or the architectural genius of its monuments, but the contribution of each and every citizen in leading India towards growth and development.
Today, India is the world's fastest growing economy, leading innovation in agriculture, healthcare, and research.
Yet, not every Indian has felt the impact of this unprecedented growth. According to Oxfam, India ranks second worst globally in terms of equitable distribution of wealth.
Inequalities of massive proportions are not just depriving communities of resources and opportunities, but an entire nation from prospering.
Good afternoon, ladies and gentlemen. We are a team of 70 undergraduate students who believe that by empowering individuals as change agents, we can transform not just communities, but our entire nation. I am Anirudh Gupta.
Harsh Garg.
Nishtha Noonwal.
Vatsal Dhaka.
Raghav Mahajan with Nikhil Kapoor on technology. And we are Enactus Shahid Sukhdev College of Business Studies.
Today, we present to you our two flagship projects, Rahat, meaning relief, and Uran, meaning flight.
Can you imagine living without toilets? For 1,300 residents of Sultanpuri, this is an everyday reality.
With extremely high rates of diarrhea and worm infections, 1 in every 10 families suffers the grief of burying their child before the age of 5. Even the children who survive are physically and cognitively stunted.
Women are robbed of dignity and face sexual harassment when they relieve themselves in the dark hours. This is the aftermath of open defecation.
Sultanpuri is not a remote village in India, but an urban slum in the national capital, New Delhi. With thousands of slum clusters like Sultanpuri, India faces a massive sanitation crisis.
But amidst this crisis, the plight of sanitation workers is often ignored.
Historically, certain communities in India were socially segregated and confined to the degrading work of manually removing human excreta from pit latrines. Considered as polluted and untouchables, these sanitation workers suffered silently. While this evil practice of manual scavenging has long since been legislatively abolished, even today, the stigma of sanitation continues and these workers are neglected. Vulnerable and marginalized, they continue to suffer.
To truly understand the problem at its core, our team studied the demand and supply factors of public sanitation in New Delhi. Through community surveys across slum clusters and engagements with municipal bodies, we learned that nearly 50% of toilet complexes in slums are unusable.
Despite investment by government towards construction of toilets, poor maintenance and vandalism render them defunct.
Given the filthy state and cultural misconceptions about toilets, people avoid their use and defecate in the open.
Sanitation workers work without equipment and receive very low wages. They face health problems and social exclusion, resulting in a low quality of life. Seeing opportunity amid systemic failures, we created Rahat. Rahat means relief. Our vision is to relieve the country of open defecation, the associated diseases, and the stigma around sanitation workers.
To set up the first chapter of Rahat, we signed an agreement with Delhi government's slum welfare body and undertook the management of a toilet complex in Sultanpuri.
We learned about the hardships of the local sanitation workers and resolved to improve their livelihoods.
Since prevailing models fail to provide adequate training and incentives to workers, leading to substandard maintenance, we developed an entrepreneurial model.
We identified 2 marginalized people for caretaking roles. Our extensive training program equipped them in plumbing and cleaning practices, interpersonal skills, bookkeeping, and provided them government-mandated kits and equipment.
These entrepreneurs manage the complex, maintain cleanliness, and ensure safety of women and children.
Users are charged a nominal fee as per government norms. Income generated is the entrepreneur's earnings after allowing for maintenance expenses and reinvestment reserves.
To encourage use of toilets, aesthetic modifications were made using concepts of color psychology. Our team developed popular movie and cartoon themes based on community likings. As a result, footfall in the complex increased, with many people using toilets for the first time.
Further, we enhanced our service design to suit different user needs, particularly women and children. Provisions were made for disposal of sanitary napkins and child-friendly modifications such as low-height wash basins.
Additionally, we introduced a system of monthly family passes at discounted rates while promoting family health through our sensitization camps.
Within a span of 6 months, the Rahat model produced tremendous results in Sultanpuri.
While only 52% of the target audience used the Rahat complex initially, aesthetic modifications increased the user base by a further 20%, followed by sensitization camps and service enhancements, which brought the remaining population on board. Today, all 250 families are proud users of the Rahat toilet complex.
As a result, rate of open defecation dropped from an alarming 95% to a mere 3%, a first-time achievement in any slum cluster of Delhi.
We strive to multiply the impact of Rahat and adopted 3 more toilet complexes.
But mobilizing large communities with differences in attitude and behavior posed an unprecedented challenge. As a solution, we customized our sensitization campaigns based on demographics.
For children, we use local games to educate them on proper use of toilets and hand-washing habits. For women, our campaigns cover topics such as menstrual hygiene and precautions to exercise during pregnancies.
As a result of our sensitization efforts, people in slums now prioritize sanitation and say no to open defecation.
In just 1 year, by adopting a total of 4 toilet complexes, Rahat provides safe sanitation to more than 11,000 people.
$286,000 worth medical expenditure was avoided through our intervention.
We empowered 8 individuals who earn $660 per month. Regarded as sanitation leaders in their community, they now have a higher social standing and enjoy better living standards.
Let's hear from Pramod Kumar, our entrepreneur at Sultanpuri, how his life changed.
मुझे राहत शौचालय काम करने में बहुत अच्छा लग रहा है, बहुत कुछ की सुविधा मिलता है। मेरे सेहत पर भी ध्यान रखते हैं लोग और मेरे परिवार पर भी सबको ध्यान रखते हैं। और मैं तो जी पढ़ा लिखा नहीं, मेरे माता पिता भी नहीं पढ़े, लेकिन मेरे बच्चे स्कूल में जाते हैं और उम्मीद मैं करता हूँ जब से राहत मिले हैं इनकी वजह से मेरे बच्चे कॉलेज तक जाएंगे और राहत की वजह से मुझे लोग जानने पहचानने भी लगे।
Rahat has been acclaimed as an exemplary model of public sanitation. With sanitation being a national priority, Rahat will now be replicated across slums in India as part of the Prime Minister's National Clean India mission, which aims to eradicate open defecation. Our team would create a network of Rahat entrepreneurs across communities and train other maintenance firms to follow standards of operations.
By June 2017, our Rahat model would be implemented across 55 toilet complexes in Delhi, impacting over 148,000 people and empowering over 100 sanitation workers.
Sanitation is more about human dignity than disposal of waste. It is about a child not falling sick. It is about a woman not fearing for her safety. It is about a community living in harmony. This is what we aim to achieve through Rahat.
We now move on to our second project, Uran.
Last year, during one of our community outreach programs in the North Indian state of Haryana, we met a girl named Gudiya. Despite being in the formal education system for 5 years, she could not even spell her name or perform basic multiplication.
Taken aback, we examined children in her village Kaloi and found similar, persistent gaps in student learning levels.
For most families in rural Haryana, the hope of escaping poverty and hunger rests on the tender shoulders of their children. With such weak academic foundations, no matter how hard they try, they will always be shackled by a deficient education.
It wasn't just the students who were failing their exams, but the education system that was failing an entire generation.
According to National University for Education Planning, 1 in every 5 elementary school teachers in India does not have the requisite skills and qualification. The students and teachers lack resources and motivation to be effective.
How could we provide these students with vast learning materials to encourage self-learning and bridge their academic gaps? The answer was clear: computers.
Kaloi, however, like most Indian villages, did not have access to computers. In fact, computer penetration in India is recorded at a meager 9%, nearly 1/3 in comparison to the rest of the developing world.
On the other hand, annually, 500,000 working computers in India are discarded to landfills. This releases toxic chemicals which cause great damage to the environment and human health.
We realized that these computers do not belong in landfills, but possess immense educational potential which can be harnessed through reallocation and reuse.
Linking these two problems together, we established Uran. Uran means flight. A flight each child can take off towards their dreams with nothing holding them back.
To set up a computer lab in Kaloi, our team procured discarded computer devices from households and corporate offices.
For teaching children computer use and its various educational applications, we searched for individuals who could take up the responsibility of running the center.
Women in rural India are victims of deep-rooted gender discrimination. With marginal share in workforce, their potential is subdued and are confined to performing household duties.
Moreover, Kaloi is located in the state of Haryana with a sex ratio of 879 females per 1,000 males, the lowest in our country. We resolved to empower women by involving them as entrepreneurs for our lab.
We identified two spirited women who underwent computer training through our partners, Tally International and Literacy India. Our team imparted them skills of pedagogy and material management.
Since they lacked access to capital, we extended them microcredit, which covered their setup and initial operational cost. The amount would be recovered in 1 year, after which we would delink the business model.
At Uran Labs, students develop foundational skills such as reading and basic mathematics through computers, using internet, text-to-speech, and open-source educational resources.
Further, the entrepreneurs ensure continuous learning by conducting regular tests and assessing performance.
In merely 5 months, overall academic performance for elementary level improved by 23%. The students were now eager to learn, which is marked by a 35% increase in their school attendance.
Gudiya, who earlier could not even speak a sentence in English, now greeted us with a pleasant smile and said, "I love going to school."
But education was not a problem limited to Kaloi. According to the annual Status of Education report, 52% Indian students in grade 5 cannot read a second grade level textbook.
With 25% of India below the age of 14 years, this presents a grim scenario where India's massive human resource would never be able to achieve its potential.
Realizing the magnitude of the problem, our team worked together to turn our pilot in Kaloi into a nationwide solution for students and learners everywhere.
Working with district administrations, we selected 12 locations across 3 states to set up Uran Labs catering to 36 villages.
Our team conducted awareness drives in these areas for greater student enrollment and to familiarize villagers to the use of internet.
1,930 students have access to better education at a mere price of $4 per month.
For expansion, we partnered with Reboot India, a Microsoft accredited refurbisher, which provides us with quality-assured refurbished computers in exchange of the e-waste routed by us.
Our innovative use of e-waste in these centers saved 700 tons of carbon footprint.
86,000 kilowatt hours of energy.
5,900 kgs of hazardous waste.
While students were marching on the path to a brighter future, the rest of the village remained in darkness with negligible access to information.
Hence, we upgraded Uran labs to information centers approved by the government's Digital India program. 500,000 villagers will now have access to 135 e-services.
Villagers who were earlier disconnected from even government schemes now have bank accounts, avail pensions, and sell their farm produce at latest market prices.
3,050 young adults have enrolled for computer courses at our Uran labs, availing jobs worth $513,000.
Uran Labs now function as an elementary education center and an internet cafe, which form the revenue streams for the lab. Through our 12 centers, we created a total of 24 entrepreneurs, each earning $612 per month. This is about 40% more than the per capita income of India.
Uran Labs utilize discarded computers to provide low-cost education by creating sustainable businesses for marginalized women. This threefold impact is the soul of Project Uran.
As we stand here representing Enactus as a CBS, we wish to highlight not just the quantitative impact or business strength of our projects, but also the magnitude of passion and commitment exhibited by the 5 people here and 30 sitting behind you.
Across our projects, we have worked in diverse circumstances, addressing national priorities and creating extraordinary success with ordinary lives.
From prejudice to pride.
From waste to livelihood.
From segregation to sustenance.
But most importantly, from hopelessness to happiness.
This course of bringing a positive change has been a beautiful journey, a journey called Enactus.
Thank you to the team from India. Judges, you may now begin the question and answer period.
Thank you very much for choosing two very important areas of human development. Now, the right to sanitation is a human right that the state must provide to its citizens free of charge. Have you tried to approach the government to assist in renovating these defunct community toilets and use it free of charge, or you were forced to ask the people to pay for it? Because I think it's a bit too much to ask poor people to pay for going to the toilet. Have you tried approaching the government? Thank you.
Thank you for your question, ma'am. I'll be answering that. Definitely, sanitation is a basic human right. The current laws in India, particularly the national capital of New Delhi, users are charged a nominal amount for using the toilet complexes. Now, this covers the basic maintenance charge, but as you correctly said, that they must not be charged. So we have tried to develop a system of monthly passes in which users are given discounted rates, and we are working with the government to work for more subsidized rates. However, given the large number of toilet complexes across India, it is not at the moment possible to provide them free of charge, as it would entail humongous amounts of funds.
Hi. What's the time span of this? Have you gone over a year? When did it start? When did all the ideas come together? Just to give us an idea of that, that'd be great.
Okay, sir, just to clarify, which project are you referring to?
Both would be great, either.
Okay, sir, so I'll be taking that question. For Project Rahat, we started our need assessment surveys back in October 2015, where we identified, and I'd like to tell you that Project Rahat actually grew out from our existing projects on public sanitation itself. So we identified the need back in October 2015, and till now, after 9 to 10 months of operations, we have been able to expand Project Rahat to 4 complexes. And Project Uran, it was first implemented last year in one of villages in the state of Haryana itself. And after the pilot of 8 months, we finally developed the Uran model that has been going on for the last 1 year.
Congratulations on your projects. They really are impressive. For the Uran project, how are you ensuring access to internet and how are you sustaining that so that they have access to the services you mentioned?
Thank you, ma'am. I would like to answer that question. For actually providing services, we're in partnership with an initiative called Digital India by the government, because of which we're actually allowed to offer all these services to the rural population. As for the internet, we have a normal broadband connection in our rural areas.
And ma'am, to add to that, we identified that there's a huge problem that these people do not know how to use computers. So we have small 2 to 3 hour courses in which these people are taught how to use various internet services. And after that, we have been able to reach around 40 to 50% of the village population. And now we can proudly say that they all can use computers.
Thank you. Have you thought about cross-subsidizing some projects like the toilet project from these economic surplus other projects generate?
Thank you for your question, sir. So, as you said, cross-subsidization. Now, this is something that is very prevalent in the public sanitation sector in India, since there are a large number of toilet complexes in communities with different population sizes. Some toilet complexes generate revenues while others operate in deficit. Now, to achieve equilibrium, these are generally cross-subsidized, and our model also follows a similar approach. And as Enactus, as a
Your
CBS...
time has expired. Judges, please join me in thanking the team from India.